When will you be going?
The group of us will be leaving on Tuesday, the 27th of March, leaving Halifax and flying over to London and then to Ethiopia and down to Kigali. Actually, it will take us about 2 days of travel before we arrive in Kigali, and then we have a 2-hour drive to our destination in Butare, Rwanda.
So that means you'll be arriving sometime Thursday?
Thursday afternoon.
So I know last year the partnership was made up of healthcare professionals from St. Martha's Regional Hospital. It's a little different this year, isn't it?
We have added a few people. So many people have shown and expressed an interest in traveling to Rwanda with us. So, in fact, we have a group of 3 from Cape Breton, a doctor, a social worker, and a nurse who have expressed interest and are coming to Rwanda with us. They'll be coming, joining us a week after we have arrived. And this particular group and myself actually will be traveling up to Uganda to visit with the Hospice Uganda program there. And then in addition, we have 2 nurses from Alberta who have expressed an interest in joining us. One of the nurses has expertise in burns and the other in neonatal care. And we have a nurse coming from Halifax as well. She's a nurse with neonatal experience also. So the focus this year will be very much on palliative care and maternal child.
Now, how is that different from last year?
Last year was a fact-finding mission. The nurses and doctors at the hospital in Butare had expressed interest in nurses and doctors from Canada, Nova Scotia, and St. Martha's in particular, coming over to educate them around mental health, palliative care, and surgical nursing. So this year, there's more of a focus now on palliative care and maternal child. There'll be a mental health stream in all of that, of course, and in palliative care in particular. So we'll be looking at offering some assistance and education around mental health also.
Now, you touched on this just a second ago, but you and some others will be going to Uganda as well, right?
That's right.
Yeah.
We have 3, actually the 3 who are joining us from Cape Breton have contacted Anne Merriman, who's a physician in Uganda, and she's a leader in this Hospice Uganda program, and we're very interested in spending some time with her and learning about her program and how she administers her program. And we'll be taking that information back to us, to Butare in Rwanda.
And share it with
sharing with the workers there.
Yeah.
We've also sponsored a nurse out of the Butare Hospital to do an intensive course on palliative care. So some funds that had been raised by the Cape Breton group were targeted for this particular initiative. So very much palliative care focus this year.
Preparations to go over. I know that all of you will be bringing not only yourselves and what you need for that trip, but you're also bringing some other things over, right?
We are. We have such a generous community here. So not only the financial support that we've received from the community, which was the bulk of that will be focused on buying supplies while we're there, and basically focusing on comfort care items for the patients who are in the Butare Hospital. The other supplies that have been donated are wound care supplies, medications. We have teddy bears that we're taking over. We have clothes, lots of clothes. We have lots of respiratory equipment that we're taking over this year. So there's 22 of us going, and we each have one bag that's filled with supplies, and we're struggling to find room for all the supplies that we are taking over. But the main supplies will be the supplies for wound care and respiratory, and the medications, obviously.
Of course, this whole thing would not have been possible without the earlier connection that St. FX made with that hospital, with their nursing
That's
students.
right. That's right. Thanks to Elsa Jensen, who has been going over there with nursing students for the past, I think this is her 5th or 6th year. She has made the connections in Butare, in particular for us, and with the nurses and doctors there. So it was about 3 years ago, I believe, her nursing students had did a small research project in the hospital asking what it was that the nurses and doctors needed or wanted there. And basically what they talked about was they wanted education. So when she came back, she approached Lynn McDonald, who then spread the word and asked for volunteers to come to go to Rwanda with a focus on the 3 streams: mental health, surgery, and palliative care, which is exactly what happened last year.
So you're getting excited?
Very excited. Living room is filled with supplies and items to take to Rwanda, and we'll be leaving on Tuesday. So we're pretty excited. We've made such great friends in Rwanda, so we're all excited to go back and visit with our friends. And we have started initiatives in Rwanda as well around supporting some vulnerable youth. So to reconnect with those youth and reconnect with our partners there, we're really excited.
All right. Just one final question. Tell us about the hospital.
The hospital is a university hospital. It's in Butare. It's a 500-bed hospital that services 2.2 million people. The hospital there is has many challenges. The nurses who work there work long, hard shifts with very few supplies. There's no food supplied by the hospital, so the patients' families have to come and provide the food, cooking the food outside of the hospital compound, and doing the basic care for their family members as well. So it has many, many challenges, but they are so excited about learning, and we're so excited to be able to bring the knowledge that we have to them.